I decided to test ChatGPT's clinical skills by asking it psychiatry questions. ChatGPT is basically like an interactive online encyclopedia, and I've browsed it a few features and it had pretty good basic information. So I wanted to ask it not only some basic information, but some a little more specific about psychiatry stuff to see how it does and how accurate it is. You can download ChatGPT app on the phone, which you can use for free. You can also just Google online, and there's not only ChatGPT, but there's a variety of services that Google, Microsoft are making. So it's pretty interesting to try out and see how accurate it is, and maybe one day it's going to put psychiatry out of business. But as you see in this video, it makes a few mistakes, or it's not totally precise, which typically a well-trained psychiatrist or mental health care provider or clinical provider is going to give better advice. So let's take a look. Is it safe to stop Prozac 20 milligrams if someone is taking it daily? And so it came with a kind of long answer, and rightly so. The initial response was that it's important to talk about the healthcare provider about effectively tapering it. Yes, you should do that. It says stopping Prozac suddenly can cause withdrawal symptoms. So Prozac is actually one of the medications with a longer half-life than a lot of other medications. Longer half-life meaning it's in the body a little bit longer than a lot of the other antidepressants. And so if anything, it's less likely to have a withdrawal reaction. And depending on the dose, you may not need to taper. 20 milligrams, you could go down to 10 for a little bit and taper off that way. But again, it may not be that crucial with this medication as far as some of the other ones. And so then it says that depression is a chronic condition and often requires long-term treatment. Well, this is like partly correct. Depression can be a chronic condition in which someone lives with it for their whole life or for most of their life, but also depression can be oftentimes due to situational factors. It could be due to substances like alcohol. It could be due to just stress in life like relationship issues, losing a job, school, various other stresses. It could even be from a result of medical conditions or side effects of medical medications. So depression can be from a variety of things. What the data does show is that if someone has a clinical depressive episode, meaning they meet criteria for these collection of 5 of 9 symptoms for over a 2-week span, at least a 2-week span, then that's considered a major depressive episode. If someone has one of those where it like affects their ability to function, it affects their work, their school, their relationships, they're more likely to have one down the road. Basically, the thoughts are maybe they're 50% more likely to have one down the road. If they had 2 clinical depressive episodes in their life, they're 75% more likely to have it down the road. If they've had 3 or more, then it gets to like the 90%. And so you want to take those into account if you're being treated for depression. Typically, the recommendations are you can take the medications if it's a first episode for 6 to 12 months. If you're 6 to 12 months free of depressive symptoms, then you could consider tapering off or stopping the medication. But know that if you've had one episode, there's a chance that you'll have it again in the future, like 50% chance, and it tends to be longer and more severe when they happen down the road. So you want to weigh the risks and benefits of the medication. It is true though, if you do start to feel better, it's important to continue taking Prozac and then talk to the prescribing doctor about whether they're continuing it or not. I then asked ChatGPT a more general question, like what's the best way to manage stress? And I was kind of impressed by their answer. They gave a pretty good system. They said stress can be challenging. You should exercise regularly, practice mindfulness, get enough sleep. These are a lot of stuff a therapist or a psychiatrist or a mental health provider will say. Connect with others, eat a healthy diet, prioritize your time, and saying that people manage stress differently and some techniques work better for some than others. So that's all pretty solid advice. It goes in very basics. A therapist might actually go into more detail about how to practice mindfulness, about what type of nutrition might be healthy, what type of exercise might be good. They might help you have like more concrete techniques or system to help prioritize things. I put more weight on religion and spiritual approach or faith. I think that's an important part, which they sort of neglected. Also, maybe hobbies or how one uses their time. Also to make sure not to use drugs or alcohol. Kind of neglected saying that, but that's often be a source of stress. Otherwise, generally speaking, that was pretty decent tips. I also asked ChatGPT, what's the benefits and risks of taking Risperdal? And you could check my other YouTube video for more about Risperdal, but it says that Risperdal is an atypical antipsychotic medication, true, used to treat schizophrenia, bipolar, irritability associated with autism, yeah. Improve symptoms, yes, it can do that. Improve quality of life, potentially. Reduce risk of relapse. Yeah, taking medications are a good way to prevent going into the hospital setting for people who suffer from these conditions. Now, side effects, it says weight gain, drowsiness, tremors, and movement disorders. Yeah, risk of diabetes. Risk of stroke. Not typically, we don't really use that as a concern, but there's a black box warning in people with dementia that Risperdal can actually cause cardiovascular issues, more like a heart attack or arrhythmia, because it prolongs the QTC interval. It says potential for abuse, but Risperdal is not typically one of those medications that are known to be used in that nature. I know some antipsychotics, the main antipsychotic I heard of that may be abused is Seroquel, also known as quetiapine, but not so much Risperdal. It can interact with other medications. Yeah, that's true, but it's not really that common. One of the things that is important with Risperdal is to have an appropriate functioning liver, as the liver metabolizes it into its active component. But otherwise, ChatGPT did a really decent job of some of the basics. I think one of the things I would have liked them to emphasize, and what I emphasize to patients, is that the movement disorders really depends on how long one takes the medication. And so it's really important to try to catch it early. If someone notices shakes, tremors, like a slow moving gait, then that's one of those signs that the Parkinson's or movement disorder type stuff is happening. And so if you catch it early, you can consider decreasing the dose or switching to a medication, a different one, try to prevent that from getting worse. Because there gets to a point where you're on the medication long enough and those movement disorder problems can be permanent, and then it can be more of an issue going forward. I then asked ChatGPT, what should I do if I'm having suicidal thoughts? Now, this is one of the few serious things that we see in psychiatry. When I was a resident, one of the attendings presented a statistic that there's 10,000 homicides in the United States each year, and there's 30,000 suicides. Now, in the news, we often think about homicides, or we see homicides on the news, and that's talked about. But to think that there's at least 3 times more suicides than homicides, we don't see suicides in the news as much. So it's a really important issue. Whenever someone threatens suicide or makes a statement of it, it's really something to take seriously. So let's see what ChatGPT says. If you're having thoughts of suicide or self-harm, it is important to seek help immediately. Here's some steps you can take. Call a crisis hotline. Okay, I would even say call 911 beforehand. Maybe go to the emergency room or nearest urgent care beforehand. Reach out to a trusted friend or family member. So sometimes we see that these family members or friends, they're not available. And when they're not available, the people have no one to reach out to until they actually act on the thoughts. So trusted friend or family member could be good, but they may not always be around and they may not always be available. So really want to look into getting into like a hospital setting, urgent care, calling 911. Those people can kind of guide you to more in a safe setting to where these suicidal thoughts can be better addressed or resolved. Contact a healthcare provider. It is important to talk about it with the healthcare provider, but sometimes when it comes in the moment or urgent things, the doctor or therapist, they may have other patients, they may not be in the office. There's just other things that are going on. So really, usually it's done in the emergency room or hospital setting. Yeah, they may be able to adjust medications, provide other treatments, that's true, but usually in an acute setting, especially if it's an active suicidal thought with a plan, it needs to be addressed in the emergency room like it finally says at the last suggestion. But it is important to take thoughts of suicide seriously. I'm not sure that the way they listed it was really serious, but again, it does an adequate job at some of the basics, but when it comes to the nitty gritty of it, I don't think ChatGPT is going to make psychiatry go out of business anytime soon.